Welcome back to the conversation. It is Adrienne Lawrence, and I know we have all been on the edge of hopefully escaping COVID, but it doesn't appear to be the reality as it is endemic, a natural and enduring part of our daily lives. But will the same be for monkeypox? We don't know, but we definitely have an expert joining us who has some insight. I want you to welcome in grassroots organizer and disaster equity advocate. That's Kristen Urquiza, co-founder of Marked by COVID. Thanks for joining us, Kristen.
Thanks so much for having me on.
Yes, so Kristen, this past weekend, the World Health Organization declared that monkeypox is a public health emergency on an international level of concern. Did this shock you?
What the data is showing me didn't shock me much at all, but I think it is coming as a shock to most people in the United States because we are not doing enough right now to keep ourselves protected.
Why do you think that the United States isn't feeling this dire movement that the World Health Organization clearly recognizes is very much apparent and at our door?
I mean, you would think that after having gone through the last 2.5 years of COVID, that we would be a little bit better on our game. And I think that's part of the issue is that we have allowed ourselves to politicize public health to the extent that we don't want to address what is happening right underneath our noses currently, which is only going to make things worse for us. The good news is that there are things that we can be doing right now that are in our power to be doing to help get on top of this.
Yeah, I would imagine there's plenty we can do, especially because we've been through various pandemics, if not just the one we're currently still in existence in, but also to see that monkeypox has risen to what I think there's about 16,000 cases now that have been detected around the globe in about 75 countries and territories. And there has only been about 5 deaths reported due to it, which all have occurred in Africa. But it does seem like it's something, especially what I've seen from the photos, is extremely painful. I wouldn't be surprised if there are long-term consequences or effects, but also something where we may not necessarily be prepared for it. Yet I do hear there's a vaccine out there. Kind of where do things stand?
Yes, we're so lucky in that there is a great vaccine and treatments available for handling monkeypox. We are not starting from zero like we were with COVID. So the difference with COVID is that it was a novel virus. This is something that has been around before. We've studied, we understand how it moves, we understand what this virus looks like, and we have treatments for it. That being said, we're not necessarily doing what we need to do to really get on top of things. And what I'm saying about specifically is that we need to be tracking this a lot closer in the data here in the United States. And we also need to be doing everything in our power to be deploying vaccines to targeted individuals, both here in the US as well as abroad. This cannot just be a US only response because this is happening across the globe.
Oh, definitely agreed. And it does seem to be on that larger level, especially with the US having so many resources available to it. It seems that there's no excuse for why not have more vaccines out there. And from what I've seen from the vaccine conversation is that a lot of efforts have been geared toward largely gay men. And that seems to have a lot of problems tied to it in part because as we saw with the AIDS epidemic, this thought that it's only really impacting this one isolated community, when that is not necessarily at all the case. And we don't want to start any kind of also health-related homophobic rhetoric to advance. And we also don't want people not getting the care that they need or thinking that this doesn't impact them. So when it comes to a social justice perspective in terms of getting people the information that they need to figure out their health needs to avoid certain consequences, where are things?
This is a really important point that you are raising right now because we are not currently getting the information we need out to individuals who are higher risk. So anyone can contract monkeypox. However, we are seeing it in men who sleep with men communities at a higher rate. And as a result, we need to be messaging to these folks on what the risk is and how to remain safe, while still also responding and responding back and pushing back on the individuals, the institutions, the bad actors that are going to be homophobic. homophobia exists whether or not there's monkeypox, and we should not be keeping information from these potentially at-risk community just because of the fear of that. And I think there is a very narrow messaging window that we need to go down. And I think that first and foremost starts with ensuring that our local public health departments have the funding they need to work really closely with impacted communities to get the resources, the tests, the treatments down to those communities right now.
Being able to get people the access to the healthcare options and the information they need is so incredibly important. And so hopefully our government will step up more. But I guess in the meantime, what can people do on the ground when we're trying to raise awareness as well as get involved to hopefully prevent another global pandemic of epic proportions?
I mean, there's a lot that each and every one of us can do. I think having these conversations is really important in keeping it alive, that these are decisions that seem to happen in a vacuum, but really, they really matter to people's lives. I think for the individual, continuing to monitor the situation, having conversations about it, but then also calling for funding to go to our public health departments so that they have the resources that they need to lead to provide us with the right information is essential. And we've seen and continue to see local public health departments limp on by whenever we need a lot more investment there.
Yes, absolutely. I think we need an investment across the board. And especially, again, I'm big on the education element. To think that it just impacts one community, that seems to be a lot of the messages here, and just knowing that so many people are unprepared. But it also definitely seems, from what I've read, at least on social media, even if just anecdotal, that there may not be enough members of the healthcare community who are fully informed. I've read stories of people going to seek medical help and asking, hey, is this monkeypox? And people don't know, or they deny that it is because maybe the individual isn't a man, and so on and so forth. And it really seems that there's not enough preparedness, particularly in communities that have lower access to resources and are more marginalized. So I guess go ahead.
I was just going to say on that point, this is why it's really important that there's not only this focus on the local community level sort of access to information, but also for leadership to be coming from the White House. So there is no reason why there shouldn't be already a state of emergency declared. There should be resources going into a monkeypox coordinator. We're seeing the COVID response coordinator, Dr. Jha, responding to monkeypox. We need him focused 110% on COVID, and we need somebody else focused 100% on monkeypox. And the great news is the federal government has the resources to be able to do that. And I think it's important that we demand that our government and our elected officials use the full power of the federal government to make sure that we are ahead of the game on this. And so far, we're not quite there yet.
No, definitely not. But of course, when our government doesn't provide universal health care, I guess they kind of don't really want to bring up so many health-related issues. And I guess I can get that. But I'd love to talk about your organization that you founded, Marked by COVID. What do you all do?
So Marked by COVID was born out of the previous pandemic with COVID-19, out of my own loss of my dad to the disease early on. But we've translated and transferred ourselves into really helping to suss out and get to the root of systemic issues within public health. Why are we still operating in a way that creates two Americas? One where some people get access to concierge care and Paxlovid within 10 hours of being diagnosed, and another America where there are people who are being put in harm's way day in and day out without access to healthcare and other basic needs. And so I really think of ourselves at the intersection of racial justice and health justice.
Yes, I would imagine a lot of it seems to be at that access of race, class, that you start to see essentially a lot of the overlapping elements when it comes to health justice related issues. And so also as it concerns the pandemic and people realizing that this is more of an endemic, a national and enduring aspect of our daily lives. Is that something that you also agree that you see it as that in terms of COVID?
I mean, what I'm seeing right now is that we have public health and other institutions that have been woefully underfunded for a really long time. And as a result, these infectious diseases are getting the best of us. So one of the things that we're really focused on is making sure that these institutions are getting the resources that they need. So as any disease comes on to our radar, we're able to respond to it in a way that isn't so disruptive to our lives. And we have a long ways to go in order to make that happen.
Yeah, it definitely seems that way. And it's so incredibly unfortunate given how much we have in the United States in terms of resources and all the things we can do with it to the betterment of the people who provide those resources. Yet it still seems that our leaders are bowing at the statue of capitalism as opposed to taking care of the people. But that's definitely a soapbox of mine. But I really, really do appreciate all the work that you do with Marked by COVID. And so if there are opportunities for people to support you or to get involved, where can they find more information?
Yeah, visit our website at markedbycovid.com. There's a ton of resources on events, community meetings, places to meet other people who, like you and I, believe that these issues are real and that the power needs to be back in the hands of normal folks to make sure that we can live long and have all the opportunities to us that our Constitution says we should have.
Yes, that is something that I think we all can get behind. That whole notion that we all should be entitled to have at least opportunities at what that whole life, liberty, and pursuit of happiness thing doesn't sound too bad right now. So hopefully there will be more of that. And I want to thank you so much for all the work that you do. That's grassroots organizer and disaster equity advocate Kristen Urquiza. That is co-founder of Marked by COVID.